A unique local program is helping young people to find employment and reduce their reliance on government welfare. It's been set up through the South Dunedin Social Sector Trial, and manager Mary-Ann McKibben is here to tell us more. Good evening.
Good evening.
What is the project that you've developed?
Well, the Social Sector Trial is all about working collaboratively with a wide variety of different agencies to improve outcomes for young people in the city. It's a flagship government programme, so it involves the Ministries of Social Development, Education, Health, Justice and the Police, but also other agencies like schools, University Polytech, NGOs, all sorts. We very quickly identified when we started up about 2.5 years ago that actually one of the key issues for youth in the city is unemployment. We've got around 900 to 1,000 young people who are unemployed year on year, and that's been going on really for around 12 to 15 years now, so it's quite a consistent picture. And we felt this was an area we really wanted to make a difference and sort of bring people together to make that difference. So we kind of went about it, set up a governance group, involved different agencies, some of those that I've cited already, so schools are important in that equation. And really our vision was about how do we prevent young people from becoming unemployed in the first place, and for those that are unemployed, how do we help them get into training or employment? We've got, as a result of that, joint work looking at it, trying to come up with new innovative ideas. We've got a programme of work which includes around 18 initiatives, I think, at the last count. It's pretty comprehensive, and it goes right through from high school age kids up to those aged 24 who are currently unemployed and working with work and income.
And
so
what's changed for local youth as a result?
One of the big things that we've done actually is set up something called Youth Link. So Dunedin Youth Link is part of Work and Income, and it's in the Community Link building where the main service centre is. But what it is a youth employment hub, so it's very much a different way of working with youth. We wanted to trial whether if we engage with young people in a different way to the normal sort of business as usual, whether that would work. And we found it has. So we've got an environment which is not branded Work and Income. It's got a group of case managers and a work broker who connects to employers who are dedicated to working with youth. It's quite a laid-back environment. It's got couches, it's got cushions, it's got the radio on, it's got street art on the wall. It's just a very different vibe really to your usual place. And what we found is that we have far more engagement from young people. When they run seminars around employment or trying to get young people programs that get them work ready, more young people turn up than they used to when it was business as usual. They've got a wardrobe of clothes to help young people sort of actually kit themselves out for an interview. They've got access to vouchers for small number of vouchers for actually getting free haircuts from the barber, that kind of stuff, which actually shows that we care about young people, that we're willing to invest in them. And as a result, we've actually, since we started almost a year ago now, we've got almost 450 young people off benefit, which has been a fantastic result.
Tell us about some of the hardships they face.
All sorts of things. I mean, some of the young people that we see through in Youth Link don't actually get much parental support or family support. They don't have networks. I found moving to Dunedin and New Zealand that actually a lot of jobs aren't advertised. It's who you know. And if they don't have those connections and those networks, it's really hard to get your foot on the ladder. A lot of them don't really know what employers expect. They haven't had work experience. They've got certain barriers to employment in some cases. For example, low-level anxiety and depression, so mental health type issues. In some cases, alcohol and drug issues. So we actually have both a mental health and an alcohol and drug clinic running through in Youth Link to provide them with that kind of support to address those barriers.
South Dunedin Sector Trial Manager Mary-Ann McKibben, I'm sorry, that's all we've got time for. Thanks for coming in.
Thank you.